Dear brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a new episode of Health from Huda TV. Today, we're going to see a rehab center. Some of us, or many of us, are not actually aware that the function of rehabilitation for a patient who had a trauma or who had a surgery is quite essential to return back to his normal life or her normal life, just as the importance of a surgery itself. Today we have Dr. Labib Muhammad, General Manager of Dar al Muna Physiotherapy and Rehabilitation Center in Cairo, Egypt. Thank you very much for hosting us today.
You're welcome.
The first question that we need to ask you about, which is more essential for the viewer to be understanding, what is rehabilitation?
Yes, rehabilitation is to let our patients be able to share and participate in the community as regard the physical rehabilitation, to be able to move his hands and legs and practice his life again.
Yes.
And physical, after physical rehabilitation, we are talking about mental rehabilitation.
Yes.
Because most of these patients are suffering from strokes or traumatic injury to the spinal cord that led to the status they have of paraplegia or quadriplegia, so they need the mental rehabilitation.
Yes.
Also, we are focusing on psychological rehabilitation, which is a very important issue to let our patients regain their psychological status and be participating freely with their relatives and neighbors and the other people in the community.
So this is a complete continuum of reproducing the person again into the community.
That's right.
To return to his normal life in all aspects.
Right.
So here we're in a rehab center, which is not very common to be seen. Usually the patients, if they had a surgery, they would go for a physiotherapist. If they have a problem in speech, they would go to a specialist of speech. Here, what's the value of having all these under the same umbrella, under one center of rehab?
Actually, when the patient come to here and see this spacious place, we are about 20 acres, and our building is about 20% only of that big distance.
Yes, mashallah.
These green areas you are seeing here is very important for the psychological status for our patient.
Yes.
And when the whole services he need are in one place, he feel like he went to the right place.
Yes.
And he will regain hope. And to have hope, this is our slogan in life here in Dar al Muna. So we are trying to give our patient the hope that he will regain his normal life again, and he will be rehab here at the mental, physical, and psychological. And when all these services are here, he's completely satisfied that all what he needs as regard his lesion or his disease that he attacked with will be fine, and he will find a solution for it.
So I want you to tell me briefly, before we go into the different sectors, about the services that the center here provides.
Yes, our main services is to offer physiotherapy activities, rehabilitation activities for all ages, speech therapy for patients who have some disorders due to brain strokes, and also the activity for special need kids or adults.
Yes.
We have a school, specialized school, in dealing with special needs patients, and we have a special curriculum for them, special people treating them, very well qualified, and doing also the rehabilitation for these special need kids to be actively participating in the community. And one of our big mission is to, after achieving the physical, mental, and psychological rehabilitation, to let our patients be able to be productive again in the community.
Exactly.
to
I'm
feel,
sure. Yes.
yeah, to
yes,
feel
I'm
that,
sure that
they still can be able to produce something, to do something beneficial to others,
yes, I'm
so
sure
they
that
can
this would
have hope
change much
to
in their
live.
lives.
Yes.
True. And I'm
Yeah.
sure that our viewers, just as myself, are very interested to take a tour into the branches of this rehab center. Dr. Labib will be taking us, please, you'll be our host today.
Sure.
You'll be taking us to the whole places and show us
You're welcome.
the details of this.
Okay.
And we start our tour here in the center by visiting one of the inpatients. And he's been here for about 1.5 years now. Dr. Labib, if we tell me about the case of Mr. Amir here. He's been here.
Exactly, he has been here for even more than 1.5 years. He has
Yes.
been here for 1 year and 8 months.
Yes.
He fell in his bathroom at home,
Yes.
and he came to us with weaknesses in both his hands and arms and both his legs, and we can say in medical terms quadriparesis.
Yes.
During this period of time, he got what he needs from the sessions for rehabilitation. Now he can move his both arms, and he can even walk by himself without assistance.
He can walk now.
Yes,
That's
sure.
very interesting.
Yeah.
Let me
Sure,
talk
we
to him,
can
please.
ask him, and he can tell you.
Yes.
Yeah.
Mr. Amir, how are you?
At your service. Fine.
You've been here for a long time, maybe a year and a half or even more. Would you tell me your condition when you first came here and your condition now? What happened? What brought you here to the center?
At first, my condition, everybody, no motion, no
Yes.
move,
Yes.
no walk.
In the arms
At
and the legs?
present,
Yes.
my condition, everybody can move, can walk.
Yes. That's very interesting. So you had your physiotherapy, you had your psychological and emotional support here in the hospital, as you've been telling me before we
I
do
don't
record.
know, but I tell you about clever doctors,
Yes.
Doctora Radwa
Yes.
Saad, Dr. Ahmed Fawdi,
Yes.
Dr. Mohammed Shaban, became now full health.
MashaAllah. MashaAllah. This is very interesting. And maybe you told me that we can even stand up and walk together.
Now I can stand and move,
Yes.
and everything can
You can manage all your life by yourself now.
now a normal case.
Alhamdulillah. Alhamdulillah. Maybe we can even
Sure,
walk
you can
and
let him walk and see.
I want to say here there are good engagement
yes.
and qualified system and beautiful life. All relations here friendly.
Yes.
I wanted to thank everybody here.
And Mr. Amir, we also want to thank you for being with us today. And we're very happy that you're walking
At
on
your
your...
service here.
Thank you very much. And now we start with the physical medicine or the physical therapy, where we gradually start the manual therapy. And with us today is Dr. Abdurrahman, specialist of physical medicine. Welcome, Dr. Abdurrahman. I would like you to show us what we do here in this cage. What's the name of this cage?
This is called the Gather Smith cage. This is used, we use some slings like this
Mm-hmm.
to help the patient do some active assisted movement.
Yes.
We could hand things, the slings, down to help the patient do some active exercises with the legs if they cannot move it properly.
Yes.
I think our Khalid here could help us demonstrate.
What kind of patient could benefit from such a device or such exercise?
All kinds of patients with motor weakness, with weakness in their muscles, after an accident, after paralysis, after surgery, it helps to give them the support and the help to assist the weak muscles to move and to strengthen it.
Yes. I would like you to show us how
Okay.
we apply
we
the
apply
strings.
this here. We could put the patient's leg here. Our friend Ali has survived falling from the 4th floor, and
Oh.
he has broke his back, and he has weakness for both lower limbs.
Yes.
And he could, by this device, we could assist him move his legs. This takes the weight of the leg, and he can move down. Good. And down. And up. And down. And up. And down. And up. The thing is, the beds we use are adjustable. I could raise the height and use it for another movement.
Yes. And it's quite rigid, of course.
Yes, yes, it has to be rigid because it gives the patient the feeling of where he is. When it's too sag or too soft,
Yes.
it's not giving him the feeling he needs.
Yes.
It's more support, and you can see it's a wide bed because it helps him to be to feel safe, and we could use it in teaching the patient how to turn around, how to
Yes.
sit with a big surface in which he feels secure enough.
Yes.
Okay, with this, he could move his leg out, حرك رجلك لبرا, and in. Good. And with the help of the slings, I could, like this, remove one and
you can
make the
change
resistance
how
less
much
and-
resistance
yes,
you
yes,
want.
Yes, according to the resistance or the assistance I use. When the patient moves down, تحرك لتحت, this is resistance. When he moves up, تحرك لفوق, it gives him assistance to get back up.
Yes.
Yeah.
Yes.
So that's
quite
an
interesting,
example
yes.
of what we use. Yeah.
Okay. Now we're in the next station, and this is the tilting table.
Right, it is. The tilting table is used for the patients who has been bedridden for a long time.
Yes.
They somehow lose the feeling of how is it like to stand up,
Yes.
and the vascular system gets affected. So we put the patient on the tilting table. It's gradually tilted according to their tolerance,
Yes.
and it helps to retrain the vascular system to regulate the circulation in the upright posture.
Right.
It also gives a sensory input in the joints of the weight bearing on the bones and the
Yes.
joints. And also it could be used for doing some exercises. I could do exercises with my patients on the tilting table, like grabbing, reaching, things like that. And I also could use it with electric stimulation for
yes, I see
muscles.
the probes here going to the electric machine here.
Yes, yes. I use this to stimulate his quadriceps, which is very essential for standing up.
Yes,
Yes, it helps. Yeah, it helps strengthening the muscles in its functional position, standing.
That's true. Yes.
Yeah, yeah.
And thus stimulating the sensation and the muscle power as well.
Yeah.
What else can you do with the electric stimulation?
It could be used for pain relief, for wound healing, and for reducing the inflammation in the joints, and some other things. We also use ultrasonic for the inflammation of the muscles, and we could also use laser therapy and magnetic therapy and several other modalities.
Okay, yes, that's very interesting. Let's go to a next station.
Okay.
We move to the next station, and this is the magnetic therapy.
Yeah.
Where you create a magnetic field around the patient here.
This device creates a magnetic field around the patient. It reaches down to the deeper tissues. It is used for relieving pain and assisting bone healing, and it's also used for cases of osteoporosis. It helps the calcium deposition on the bone.
Inside the bone.
Yes, yes. And it also helps in relieving any inflammatory process in the body. It could be used for sports injuries, for after fractures, and for arthritis.
Yes,
as
of course.
Yeah.
It can move according to which.
This could be moved to according to the part we need to focus on. If I'm concerning the knees, I could move it there. If I'm concerning the feet, I could move it there. Or if I'm concerning the arms or shoulders, it could be moved up all the way.
Yes, quite interesting.
That's very.
How long does a session take?
According to the case, according to the goal of my treatment, it could vary from half an hour to almost an hour.
An hour.
Yeah.
Yes.
Yeah.
Let's move to another station.
All right.
Assalamu alaikum. Shafak Allah afak. Ahlan wa sahlan. So this is another device.
Yeah.
This is the.
It's called the Motomed.
The Motomed, yes.
And it provides assistive movement to the patient. If the patient cannot move at all, the device moves automatically. And if he could gradually, when he develops his strength, it provides assistance until he could move alone, and then it gives resistance.
Yes.
And on the monitor, it shows the strength of the muscles, the tone of the muscles, and the speed that the patient is working on. And at the end of the session, it gives a report of how long the patient has moved and how much the power he produced, as a kind of feedback for the patient. So he gets motivated, he wants to do more, and he knows the quality of his exercise.
And of course, this gives you the chance to monitor the improvement of the patient's case.
Of course it does.
Day after day.
Yeah. Of course
very
it does.
interesting, yes. So this is the butterfly.
This is, the
or
butterfly.
The butterfly tub.
The butterfly pool.
Yes.
We use it for hydrotherapy for patients who need it.
Yeah.
The patient gets on the left if he cannot get into the pool. He gets on the left. It raises, and the patient is placed in the pool. And those are the engines. We turn the engines. It makes like strong currents of water, like the jacuzzi, you know.
Yes.
And it helps in massaging.
And it's heated as well.
Yes, it's warm water. It helps in the sensory stimulation. It helps in releasing the muscle spasms and the tightness of the muscles. The interesting thing about hydrotherapy is that the water lifts up the patient's weight, so he feels freer to move.
Yes.
With the warmth and the currents, it makes it easier for the patient to move. It relieves the patient's pain, and he gets out of the pool more fresh and more able to do activities and to move.
And when working inside is working against less gravity.
Yeah, yeah,
This is
yeah.
very
Because the weight is lifted up because of the water. Some places they have bigger pools with movable ground.
Yes.
So you immerse the patient down to the level you need, and it really helps in teaching patients how to walk, because he doesn't have to carry his weight.
Yes,
Yeah.
that's true. Very interesting. So this is another hydrotherapy machine.
Yes, it's called the 4-cell path.
Yes.
And it is special for cases of neuropathy. You know, with diabetes, people
Patients
get
with inflammation of the nerves, the endings especially.
Inflammation, at the ends of their limbs, the hands and the feet. We call it glove and stock neuropathy.
Yes.
Yes. In this device, the patient sits on the chair and immerses both his hands and both his feet into the cells. It provides electric stimulation under the water.
From these plates here?
Yes, the metal plates inside, they are electrodes. When the water is there, the water acts as a medium for connection of the electric current, and it makes a kind of stimulation for the nerves. This really helps in reducing the tingling sensation, the numbness that they feel, and it helps improving the peripheral circulation for the hands and the feet.
Yes.
Yeah.
That's very interesting. And now we've reached to the gym, where many of the machines, as you have seen here in this place, many of them have different functions, but one of them is very attractive. This one, where you can hook up the patient? Or what do you do to the patient?
Not hook up the patients. This is called the suspension treadmill.
Yes.
We use this jacket. It's like the jacket they use for jumping.
Yeah.
I can't remember the name.
The parachuting.
The parachuting, yeah.
Yes.
We lift the patient's weight. There is some weights there that neutralize the patient's weight, and it lifts the patient's weight up, so he doesn't have to put all his weight on his lower limbs.
Yes.
The treadmill works, and he learns how to walk with as much strength he has as possible. He doesn't have to
Does
put
only a partial
weight bearing.
Yes.
Yeah. He doesn't put all his weight on the feet. He puts as much as recommended or as he can. Sometimes with operations like joint replacement, the hip or the knee, it's not recommended that the patient puts all his weight suddenly.
And still you need him to walk, or
yes, still we need to ambulate him.
Yes.
So this is used to lift his weight, and we put gradually as much weight as needed for the stage. And as a progression, when the patient gets better, the weight, we take the weight, so less support is provided, and more weight he puts on the limbs until he moves freely.
That's good.
Yeah.
Okay. After passing through all these stations of physiotherapy here in the center of the rehabilitation center, I would like to have some sort of a summary from you, Dr. Abdurrahman, about which cases would benefit from the physiotherapy and all the machines that we've been seeing.
Yeah, it's actually a wide range of cases. We deal with neuromusculoskeletal problems. That means that we deal with people with problems in the nervous system, like the brain or the spinal cord or the peripheral nerves, people with stroke, spinal cord injuries, ataxia, Parkinsonism, all varieties of cases. and also the musculoskeletal problems, like problems with the joints, arthritis, after operations, after accidents,
Exactly.
after hip replacement. And we also provide services for geriatric people, for elderly people.
Yes.
We provide care for people with Alzheimer's problems or the manifestations of old age. All this range, this wide range of patients is benefiting from our facility. Moreover, we provide some care for pediatrics too.
Yeah.
People with children with brain damage. We call it cerebral palsy.
Yes, children with special needs, which
yes.
is very difficult to deal with.
Yes. Actually, in our facility, we have a school for children with special need. They teach them speech, they teach them activities like recreational activities and communication activities with others. We also provide psychological reassurance for our patients and social reassurance with our patients.
Very important to cover all the aspects, not just the physical aspects.
Of course. They also have to be involved in recreational activities like parties, trips, and all other activities. They need to be treated like we all normally want to be treated. This improves their quality of life.
Yes, that's very interesting. Thank you for taking us through this very useful tour.
It's been a pleasure to me.
Finished with us, so thank you.
Thank you very much.
So after this tour we had in this rehab center, first I would like to thank Dr. Labib. Thank you very much for.
You're welcome.
This has been very interesting to me and of course to our viewers. What message do you have for our viewers?
I would like to tell our viewer that our center is a complementary center offering service is not existing in the whole country, even in the Middle East and North Africa. This complementary service is very important for those who are being attacked with these diseases or this accident that led to this injury of the spinal cord, and they were searching about a place like this to have all the services in one place and to regain hope, as our slogan that I told you before, where hope is living.
Hope is living.
Hope is living.
Yes. Yes. Dear viewers, hope is living. Thank you very much for being with us today. I hope that we would meet you, inshallah, in a next episode. Until then, please write to us. Our email is health@huda.tv and our website is, of course, huda.tv. Until next time, Assalamu alaikum wa rahmatullahi wa barakatuh.